Hello, this is Mr. Harris. Today we will introduce some information about how to determine the severity of my tinnitus. Basically, to answer the question, is my tinnitus serious or not? And we will also talk about how to treat or offer some treatment options to tinnitus sufferers. How to decide the severity of a tinnitus, scoring from 0 to 100. We have a few grades. Grade 1 is slight or no handicap if the score is between 0 to 16. Grade 2 from 18 to 36 for mild handicap. Grade 3 moderate handicap covering 38 to 56. Grade 4 is severe handicap covering 58 to 76. Grade 5 is from 78 to 100. That's unfortunately catastrophic handicap. How to classify my tinnitus into 5 grades. Here is the way to go. We have a questionnaire called the Tinnitus Handicap Inventory. We have 25 questions to answer. We can see one by one. The first page is question 1 to question 6. Because of tinnitus, is it difficult for you to concentrate? If we answer yes, we get a score of 4. We can also answer sometimes or 0 for no. So we can answer this question based on reality. And second question, does the loudness of tinnitus make it difficult for you to hear people? Again, yes for 4, sometimes for 2, and no for 0. Number 3, does your tinnitus make you angry? Does your tinnitus make you feel confused? Like sometimes I feel confused about what I should do next. Things like that. Number 5, because of tinnitus, do you feel desperate? I feel, there's no hope. I feel really desperate about my tinnitus impact on my life, so on and so forth. Based on degree, we choose yes, sometimes, or no. Number 6, do you complain a great deal about your tinnitus? Do we complain to our surrounding people, family members, friends, colleagues, classmates, and those people surrounding us? Do we complain a lot to them? Page number 2 covers questions 7 to 17. Number 7, because of a tinnitus, do you have trouble falling to sleep at night, like insomnia? Do you have it or not? Number 8, do you feel as though you cannot escape your tinnitus? Like if I feel I'm trapped in tinnitus forever, that kind of feeling, yes, sometimes, or no. Number 9, does your tinnitus interfere with your ability to enjoy your social activities, such as going out to dinner, to the movies? Like if I'm impacted on the aspects of my social activities, going out, eating, and having fun, I might be impacted by tinnitus. Number 10, because of tinnitus, do you feel frustrated? Because of your tinnitus, do you feel that you have a terrible disease? Does your tinnitus make it difficult for you to enjoy life? Like, I cannot enjoy my life as before. I always think about tinnitus. It makes my life difficult to enjoy. That's a question for number 12. Okay. 13. Does tinnitus interfere with your job or household responsibilities? 14. Because of tinnitus, do you feel that you are often irritable? Because of tinnitus, it's difficult for you to read. Sometimes I feel hard to read anything, books, online threads, and all those things. Does your tinnitus make you upset? 17. Do you feel that the tinnitus problem has placed stress on your relationship with members of family or friends? So page 3 covers question 18 to 25. Like, do you find it difficult to focus on attention away from your tinnitus and on other things? This is about concentration and focus. Do we lose focus or not because of tinnitus? 19. Do you feel that you have no control over tinnitus? 20. Because of tinnitus, do you often feel tired? 21. Because of tinnitus, do you feel depressed? 22. Does your tinnitus make you feel anxious? 23. Do you feel that you can no longer cope with your tinnitus? It's like I cannot handle it. I cannot handle this. That kind of feeling. 24. Does your tinnitus get worse when you are under stress? So to figure out is there any association between stress versus the degree of tinnitus. Does your tinnitus make you feel insecure? So like I feel I'm not safe. I don't feel any security at all with ongoing tinnitus. So the questionnaire is downloadable PDF. If we fill all the scores for the 25 questions, automatically there will be a total score showing up here called THI score. That's basically a summation of all the scores of all the responses. So this is original time and place this THI was proposed, and it has been widely accepted by clinics and hospitals. So of course we can print out the pages and manually fill out them and sum all the numbers together. So eventually we will get all the numbers, and we will be able to see what does each number mean for their corresponding grade. So if we see this above Tinnitus Handicap Inventory, we will see there are 5 grades covering score 0 to score 100. As we have introduced, they cover from slight or no, mild, moderate, severe, or catastrophic handicap. Where the THI questionnaire was published, it is published on the website of American Tinnitus Association, and we can download this THI Tinnitus Handicap Inventory from this ATA website. ATA, American Tinnitus Association, is a non-profit organization that helps people with tinnitus, basically the patients, and also their healthcare provider, basically the doctors, both sides. So I get my score, I know my grade, what do I do next? So let's first take one step back, understand what tinnitus is. Tinnitus is a sensation of sound when there is no external sound. Such imaginary or perceived sounds are sometimes buzzing, ringing, whistling, or clicking, like shh kind of sound. Other people usually cannot hear it. And tinnitus is a common problem. About 15 to 20% people have tinnitus sometimes in their life. Especially, it is common in older adults. What are possible causes for tinnitus? What are some treatment options for tinnitus? We are going to introduce first causes. Common causes are first, noise exposure. Many people experience tinnitus after being exposed to loud noise in a workplace setting or at a sporting event or even a concert. Tinnitus is also the most common service-related disability among veterans. Because of loud noise they may have experienced from gunfire, machinery, boom blasts, or other similar sources. Hearing loss. Hearing loss, which can be caused by factors such as aging or exposure to loud noise. Again, loud noise, right? Loud noise is very harmful. Is strongly associated with tinnitus. Some people with hearing loss, however, never develop tinnitus. So, hearing loss, tinnitus are somewhat correlated, but not 100%. Medication. Tinnitus can be a side effect of taking certain medications, especially if they're taken at high doses. Medications associated with tinnitus include non-steroidal anti-inflammatory drugs, for example, ibuprofen, naproxen, and aspirin, certain antibiotics, certain anti-cancer drugs, and malaria medications, and antidepressants. Sometimes tinnitus is caused by earwax or ear infection. Blockage of ear canal by earwax or by fluid from ear infection may trigger tinnitus. Number 5 is also one of the most common causes: head or neck injuries. A head or neck injury can damage structures of the ear, the nerve that carries sound signal to the brain, or area of the brain that processes sound, which is called temporal lobe, causing tinnitus. Some less common causes. Number 1 is Meniere's disease. Tinnitus can be a symptom of Meniere's disease, an inner ear disorder that can also cause balance problems and hearing loss. Jaw joint problem, TMJ. The joint that connects lower jaw to the skull is close to the ear. Jaw clenching or tooth grinding can damage surrounding ear tissue, causing or worsening tinnitus. Number 3, tumor-related disorder. A vestibular schwannoma, also called acoustic neuroma, is benign tumor on a nerve that leads from the inner ear to the brain. Acoustic neuromas and other head, neck, or brain tumors may cause tinnitus. Blood vessel problem, high blood pressure, atherosclerosis, or malformations in blood vessels, especially if they are in or close to the ear, can change blood flow and cause tinnitus. Chronic conditions, diabetes, migraines, cellular disorders, anemia, and certain autoimmune disorders such as lupus, multiple sclerosis are among the chronic conditions that may have been linked to tinnitus. Okay, so far we introduced 5 common causes and 5 less common causes. Total is 10. What if my doctor finds my tinnitus is caused by one of the 10 causes? Of course, my doctor will treat me accordingly based on the cause. However, chances are, after ruling out above 10 causes, a doctor still may not find a reason for some patients. The chances are not very low. What can we do? Music therapy may be a useful solution. In fact, Mozart Sonata reshaped the brainwave oscillation and successfully treated the 62 chronic tinnitus patient, according to a research paper on a magazine called Acta Otolaryngol. The degree of improvement was determined using the above THI questionnaire. The research was published at this link. Let's continue to talk about this music therapy, Mozart Sonata K.448. authors G. Atanasio and others find out the Mozart therapy could be a valid alternative to the common therapy methods in tinnitus patients. In their study, a tinnitus patient should listen to the Mozart Sonata K.448 for 1 hour per day for 30 days. The volume at is a comfortable level, not loud. After 1 month, tinnitus was significantly improved in all 62 patients. So, where do I listen to the Mozart Sonata K.448? Here a link you can use, and the link is also put in YouTube comment section below the video. So all links of these slides are put in YouTube comment section below the video. If you have any question or comment, feel free to reach out to me. Thank you for your time.